Welcome, friends, and thank you for tuning in to another episode of the Optimal Health Program. I'm Dr. Chris Calapai, and we have a wonderful guest today. We'll be talking about a pretty scary scenario and how over time the gentleman has done extremely well with stem cell therapy. So let's bring Phil onto the studio, onto the mic. How are you doing today?
Doing well.
Good to hear. So you have a very interesting story, and want to sort of walk through the time frame of what happened to you, with the specifics of how your body changed. You ended up having a stroke of the basal ganglia in 2012, which most people do not survive from because it's such a severe insult to the brain. Can you walk us through what happened when you first realized you were having a stroke?
So it occurred in September of 2012. I was lying in bed. I had a golf outing that day. As I was getting up, I felt a sharp pain behind my eye, and I felt a warm sensation in my head. I got up, I went to the mirror. It didn't feel right. The left side of my body wasn't working properly. So I knew something was wrong. I just couldn't figure out what it was. I went to look in the mirror and I couldn't smile on the left side of my face. So I said, oh, I must be having a stroke. I went downstairs to the medicine cabinet and thought that maybe I should take aspirin. So I picked up the aspirin containers and I was reading them because there was Advil, Aleve, Motrin. And I was trying to read the aspirin containers, but none of the letters looked like letters. I couldn't read anything. They looked like Egyptian hieroglyphics. So realizing something was wrong, I called 911 and an ambulance came and took me to the hospital.
And prior to this, you were in terrific health. You ran marathons and half marathons.
Yes, I ran 4 complete marathons, 13 half marathons. And as a matter of fact, I was training for my 5th marathon when this incident happened.
And you had no real medical issues up to that point?
No, none at all.
It's amazing. Scary for people to think, that this could happen at any time to anyone, anywhere, anyhow, especially for someone, who is very athletic. So at the time and when you were in the hospital, you went through rehab and such, but where were the deficits? You didn't have great focus, concentration, memory, speech?
So I was in a rehab hospital for 5 weeks afterwards. I had no feeling on the left side of my body at all. On the left side of my nose, left side of my mouth, my left arm, my left hand, my left hip, leg, and foot had no feeling whatsoever, and I had no muscle control of those areas either. In addition, I couldn't think clearly. I couldn't sleep through the night clearly and dream. I had a hard time eating and drinking because the left side of my throat wasn't working. Accessing my memories was difficult as well. I didn't lose any memories, I just couldn't access them. So if somebody walked in the room that I hadn't seen in a while, I would know that I knew them, I just didn't know where I knew them from. And eventually I would figure it out, but it just took a few minutes to think about it. The best way to describe it is if you didn't know what peanut butter was, but then when you tasted it, all of a sudden, it would be like you discovered peanut butter, like, oh, peanut butter, I know what that is. Mm-hmm. And it was like a revelation to me that, oh, Chris, how are you? I do know you.
Mm-hmm. So difficulty also with word retrieval and the thought process?
Very difficult word retrieval in the beginning. It was, the words were there, they were in my head, I just couldn't get them to my mouth and spit them out.
And so you did a good amount of rehab, with, physical therapy and such, Botox injections.
So for the next 2 years, I went to physical therapy 2 or 3 times a week. I had muscle cramps. I suffered from spasticity. But I really wasn't progressing with my physical therapy. I went through hyperbaric treatments where I went in a hyperbaric chamber for a while and got the blood oxygen go into my brain, which helped a lot. It helped with sleeping and clarity in the brain. But muscular-wise, I really wasn't progressing. I went to Chris Calapai's office, and he suggested I look at the stem cell treatments. After my first stem cell treatment, let me back up. With the spasticity, I was going to my neurologist, and he was giving me Botox injections, which helped with the muscle cramping and everything. The problem with the Botox, it only lasted for 90 days. Every 90 days, I'd have to get a new treatment of injections. After my first stem cell treatment, within 12 hours, I no longer had muscle cramps or spasticity. And interestingly enough, I got my stem cell treatment on a Monday. That Friday, I had already scheduled a Botox injection treatment. I called up the doctor on Wednesday and said I didn't need it, I didn't have the issues anymore. And he said, that's impossible. You know, come in and let me examine you. When he examined me, he said, what did you do? Like the muscles were moving freely and uncramped. And I said, oh, I had a stem cell injection. And he then took down Dr. Calapai's information and was amazed that the cramping and spasticity went away.
I remember speaking to him. He just couldn't understand it. It just didn't make sense to him. And of course, he wasn't fully aware of how your stem cells work. You know, they typically will go to where damage and degeneration is, just like your antibodies go where there's infection, and any of all the immune cells will go find infection and attack it. Your stem cells with chemical messaging will go to where the damage or degeneration or inflammation is and become brand new cells of that tissue: heart, lung, liver, kidney, pancreas, brain, gut, joint. And the amazing thing was within the 12 hours, he started to feel the spasticity went away. And what were the next things you started to feel?
Well, within 12 hours, I had no feeling on the left side of my face whatsoever. But the next morning when I woke up, I had feeling around my eye and around my mouth, like actual touch feeling. At first I thought I was imagining it. I'm like, this can't be true. But as the day went on, I would touch it with a pencil, touch it with a ruler, and I certainly had feeling. Later that week, I went out to lunch with my coworkers, and I was eating a sweet potato fry. And I was tasting it, and I'm like, wow, this tastes great. I didn't realize I had no feeling on the left side of my tongue either. Mm-hmm. But the food tasted amazing. I was speaking better because my tongue was working properly. My face felt great because I could feel it. I could smile. I could just have feeling in my face again, which I didn't have.
And the progression of, you know, your ability to walk and move and balance, and that came soon after.
So I had no muscle control in my shoulder going down into my arm. With the first stem cell treatment, I had feeling in my shoulder. I was able to move the shoulder forward and backward, and slowly the feeling over the next couple of weeks and months went down to the bicep, tricep area. And after my second or third stem cell treatment, it went down to the feeling and control went down to the forearm and the elbow, and eventually to the wrist and the hand. Also, at the same time, I got feeling and movement in my hip, which went down into the hamstring area, then into the knee and into the gastrocs and the calf area, and later on into the ankle and foot. And I regained control, muscular movement, muscular control, and strength.
We have a variety of patients that have had stroke, and certainly you've been very, very generous to allow people to talk with you about how well you did, and the stroke patients that we've treated have very similar results. A lovely woman who had a stroke and lost, focus, concentration. She kept falling and tripping at home. Was brought into the office by one of my existing patients. It was her aunt. So the niece brought the aunt into the office, and we did the procedure. And then we usually follow people up about 3 to 4 weeks after the procedure to start documenting things that we see. And as certainly you did, talking about the improvement in your face and your arm and the spasm, et cetera, and the brain benefit, she gave us a list of all these things that were improving. And about 2 months later, she came in for another follow-up. And I had seen the niece first, and she was showing me pictures. And showed me pictures of a beautiful garden and, a freshly painted garage. And I just didn't understand, why she was showing these pictures. And I thought that, she did all of that. And she said, no, I didn't do that. Janice did that. I said, are you serious? Janice, after how bad she was and her improvement was that dramatic that she was able to plant her garden and paint her garage and part of the house. And she said, absolutely. So her progression similarly has been amazing. Just impossible to think that someone can go from such a bad area to such a good area, a good zone, and be able to exercise and walk and do all the things that they've done before. So very important to allow your body to heal itself and to create repair. That's sort of the idea, is to make your body as strong as humanly possible. And you're doing a good amount of exercise and activity now?
I am. Chris, I went from running marathons to being in a wheelchair to walking with a quad cane. Now I climb 5-6 flights of stairs a day. I walk up to a mile a day.
Wow.
And it's okay if I never do another marathon. I'm okay with that, but I would like to be able to run again, and I think I will.
Yeah, that's great. Just got to keep working and keep training your brain and your muscles to do that activity. So people don't realize it takes a little bit of time to repeatedly tell your muscles what you want your body to do, and then as your brain continues to heal, from the treatment, you'll get more and more benefit. You had another gentleman who had a stroke, and he was born in Italy and was unable to speak Italian, and his words were slurred. He couldn't get the word retrieval in, and Italian was his first language. And similarly, about a month or so afterwards, he was able to regain his thought process, speak normally, speak Italian fluently again. So he had also some significant improvement in walking and mobility. It's just amazing what your body can do, given the right stimulus to create repair, and that's really what it does. So, and we track everything that we see with patients. We give them a symptom checklist so they can write their symptoms down on one side of a page, and then week to week write down the benefits, and we put that all into the medical record. So the reality is your body has amazing healing capacity. We're just giving it that extra boost. People will always ask, why don't stem cells go to the area of damage as they do when you do it? On its own, your body will send some cells out, but they go out in the thousands. We're talking about this mechanism of repair, being in the billions. So we're taking about 60 cc's of bone marrow, which, after we extract it, comes back to normal in that volume of fluid and cells within about 2 weeks. And we're putting it either to a space, either in a joint to repair damage to ligament, tendon, cartilage, or intravenous, which we use for liver, kidney, heart failure, lupus, rheumatoid, diabetes. A nebulizer breathing into the lungs, as asthmatics might breathe a medication mist to topically touch their lungs. We put the stem cell and liquid into there and do an IV for those patients for COPD, emphysema, pulmonary fibrosis. And we use a nasal droplet along with the IV stem cell for MS, Parkinson's, Alzheimer's, stroke, diabetic retinopathy, macular degeneration. And there's a great deal of research on stem cell therapy throughout the internet. So we try to gather this information, show people, hand them articles, give them information such as this. Having the podcast will go out to many, many people who need to know and see and hear from someone who's had it done to see the amazing benefits from it.
Well, Chris, not only did the stem cells help me with my stroke symptoms and feeling much better, but every time I did receive stem cells, holistically, I felt wonderful.
Mm-hmm.
I used to suffer from seasonal allergies. No more.
Wow.
My appetite improved. My sleeping was reduced to 7 hours a day. I wake up, I'm alert.
And you feel sharp.
Sharp?
Yeah.
Yes.
So you were sleeping more, but weren't getting really good, deep.
I was not getting any sleep. No.
Wow.
Rest.
Well, 7 hours is great, especially if you can wake up and feel good from that.
I do.
So, to be a little bit more specific about it, when you do the nasal droplet after the IV, you're dripping the stem cells into the back of the nasal cavity. So, in essence, as they hit the back of your nasal cavity and you're lying on your back, with your chin towards the ceiling, you're allowing those cells to get into the membranes and into the blood vessels and into the brain. That's an absolute. And as they get into the brain, they're going to areas of damage and degeneration, shutting down some inflammatory mechanism, because whatever cells are damaged or they have a loss of oxygen, vitamins, and minerals in blood flow, or there's a clot that stops the blood flow from getting to that area, cells start to break down and die, and there's an inflammatory mechanism around that. The area of the cells that are damaged but not dead yet is called the penumbra, and that area of cells certainly is important. You want to get those back to normal functioning cells and highly functioning cells. So as that happens, and you're making brand new cells that make neurotransmitters, you have more neurotransmitters being produced, because the action of that stroke is killing cells that make the neurotransmitters. So that's the specific pathway of how that can work. So it can be a very dramatic change, and this is what we want to do. We'd like to do it for all stroke patients, like to do it for all patients that have MS, Parkinson's, Alzheimer's, and such. So we want to be able to get this out to as many people, who could benefit from it. And there's no downside to it, no side effect, no risk. They're your cells. It takes about 1.5 minutes to extract, half hour to spin, and we put them back into the body. Okay, well, thank you so much for coming in and sharing your story. It's a wonderful story. And thank you for talking to the patients that you've spoken with who want to speak to someone who's had the procedure done. So we look forward to having wonderful results for you going forward.
Thank you,
And it's always a pleasure chatting with you. Thank you so much.
Thank you.
Another great story from a patient who had a very, very serious condition that is now very far behind him. And his ability and function continues to improve day to day, month to month, and we're very happy for that. We would love for you to send out this video to friends and family, to like our podcast. Certainly you can contact us at the office, 516-794-0404. Website is drcalapai.com. And all the videos that we do will be on YouTube. So that's also Dr. Calapai, Dr. Chris Calapai, my YouTube channel. And as well, audio will be sent out to a few of the other podcast stations. And we'll have video on Spotify, I think, as well. Right, Frank? So Frank is the engineer who's making all this happen. He's the genius. I'm just a guy sitting back here waiting to go for a bite to eat. Going to have lunch in a little while. We will soon be doing this in a live fashion where we'll give you a phone number we can call, and you can call in and ask a question. So I'll be here every Monday and Friday, and I come in here at about noon. We relax, have a little cup of coffee, chat. Frank shows me that all the equipment is working well, and we'll be doing some more interviews. We'll have doctors on, we'll have athletes on, we'll have nutritionists and people from all walks of life. I spoke to a couple of people that are celebrities, actors, actresses. I like for them to be able to talk about their health, their fitness, their diet routines. As I've always said, I like to speak to motivated people and get them to motivate other people. So this is the goal, to really educate people as much as possible. So thank you for tuning in, and we'll see you soon.